name is Brittani. This is for Nurs355 physical assessment. Today I'm going to be doing a neck and heart assessment on my patient Billy. Billy, is it okay if I do a neck, vessel, and heart assessment on you today?
Yes, ma'am.
Okay, great. I'm going to start on the right side of my patient. I'm going to have her laying in a supine position with the head of the bed elevated 30 to 45 degrees. For the purpose of this demonstration, I'm going to allow her to remain clothed, but normally I would like to do this assessment on bare skin. So first I'm going to start with assessment of the neck vessels. So if you could turn your head away from me, please. Thank you. Okay, so I'm looking for I'm assessing the jugular venous pulse at the suprasternal notch. I should be able to visualize. If I can't, I can always use a pen light or an exam light to help visualize this. I'm also assessing jugular venous pressure by placing the patient in 30, 45, 60, and 90 degrees, head of the bed elevated. If I notice any kind of bulging or abnormality greater than 45 degrees, I would want to note this and document as that would not be a normal finding. Okay, you can bring your head back to center. Thank you. Okay, next I'm going to auscultate the carotid artery using the bell of my stethoscope. And I'm going to ask the patient if you'll hold your breath for me while I do this. Okay, great. So what I'm listening for there, asking the patient to hold her breath so that the breath sounds don't mask my findings. I'm listening for the absence of a bruit, which would be a swishing sound, which would be an abnormal finding. Next, I'm going to palpate the carotid artery using 2 fingers. I'm going to go medial to the trachea, or to the side of the trachea, medial to the sternocleidomastoid muscle. Okay, and I would never want to do that simultaneously bilaterally on both sides so that I wouldn't obstruct any blood flow to the brain. And when I'm feeling what I'm feeling for, I'm looking for the amplitude and contour of the pulse, elasticity of the vessel. And I'm also feeling for any thrills, especially if I had heard a bruit upon auscultation, as this can indicate narrowing of the artery. Okay, now I'm going to continue with assessment of the precordium. I'm going to start with inspection of the apical impulse. The apical impulse is found in the at the fifth intercostal space in the midclavicular line, right about here. I am assessing for pulsation. I'm also assessing for pulsation anywhere else in the precordial area, which would be abnormal. I should only see pulsation in the mitral area. So next I'm going to palpate the apical impulse. I'm going to use 2 fingers at the fifth intercostal space, midclavicular line, and I'm feeling for a brief tap. If I have trouble feeling this, I can ask the patient to turn onto their left side. Do you mind turning on the left side? I'm going to feel with the palm of my hand in that area, assessing for a brief tap. Okay, great. You can roll back for me. Reasons I might not be able to feel that would be obesity, enlarged breasts, or emphysema. Next, I'm going to auscultate the heart sounds. I'm going to use, for the purpose of this demonstration, the diaphragm of my stethoscope. So I'm going to start in the aortic area at the second intercostal space to the patient's right side. Move to the pulmonic, which is the second intercostal space on the patient's left side. Down to the Erb's point, which is the 3rd to 5th intercostal space, the patient's left side. Down to the tricuspid, which is the 5th intercostal space on the patient's left side. And over to the mitral area, which is the 5th intercostal space, midclavicular. So I'm listening there. Normal sounds, S1, S2. Abnormal sounds I would be looking for would be an S3 or S4, extra heart sounds. Also, I'm listening for any kind of murmur, and when assessing for a murmur, I would use the bell and the diaphragm of my stethoscope, as this can help in distinguishing different tones in the heart rate and heart rhythm. And also, if I'm listening for irregular rhythm. If I note an irregular rhythm on auscultation, I can assess for a pulse rate deficit by listening and feeling for the pulse, palpate the radial pulse, and auscultating the apical impulse for 1 full minute. Another way assessing for a murmur would be to have the patient roll onto her left side, or have her sit on the edge of the bed, leaning over and exhaling while listening at the apical impulse for any kind of murmur. So this concludes assessment of the heart and neck vessels. Thank you for being my patient.